Intrauterine devices, also known as IUDs, are small T-shaped contraceptive devices inserted into the uterus to prevent pregnancy. There are two types available in Australia, the copper IUD and the hormonal IUD, more commonly known as the Mirena. The copper IUD constantly releases a small amount of copper into the uterus, whereas the hormonal IUD slowly releases a hormone called progestogen into your uterus, which is the hormone produced by the ovaries. Both copper and hormonal IUDs are more than 99% effective at preventing pregnancy. The copper IUD is designed to stay in place for up to 10 years and the hormonal IUD for 5 years, but both can easily be removed sooner if needed. Both IUDs do not give protection from sexually transmissible infections. As you can see in the image above, there have been many models to get the IUD into what it is today. The first published paper on IUD insertions was made by Dr. Richard Richter in 1909 in Germany. The device he inserted was a ring made of silkworm gut, but this was not widely used. Then, in the year 1969, Dr. Jamie Zipper discovered that using copper wire was effective, thus the creation of the copper IUD. The hormonal IUD only then being approved by the FDA in 2013, making its introduction fairly recent.
IUDs are very reliable, safe, and suitable for women of all ages. They can be used in women who want to have children in the future as well as in those who do not wish to have any future pregnancies. It is also suitable for women who cannot use estrogen-containing contraceptives, such as those with a history of stroke, diabetes, migraines, or other forms of vascular disease. Some of the many benefits of an IUD include that they are a very successful method of contraception, preventing pregnancy at a rate of 99%. According to clinical trials, IUDs are far more successful at preventing pregnancy than pills, patches, or rings, with a failure rate of 0.27 per 100 patients, compared to 4.55 per 100 patients for pills, patches, and ring users. An IUD is also a long-term, low-maintenance solution for women who do not want to remember to take a pill every day. These types of contraception can last from 3 months to 10 years of protection against pregnancy. They are also reversible, meaning that they can be stopped or removed at any time and do not have a long-lasting impact on the ability to get pregnant.
Health risks associated with pregnancy have been prevented by the IUD. There are limited side effects, however, discontinuation of use and perforation are still prevalent. Discontinuation of use usually causes dysmenorrhea and menstrual bleeding. The perforation of the uterus occurs every 1 to 2 per 1,000 insertions. This is typically attributable to anatomy factors and clinician expertise. Initially, the perforations are not recognized during insertion and are usually discovered after a patient presents with pregnancy. In this case, copper IUDs are to be retrieved immediately as copper ions have the ability to cause inflammation, and multiple cases have been reported of the copper IUDs being eroded into the gastrointestinal tract and the bladder. Moreover, studies have reported that discontinuation of the IUD typically occurs after the first year of use, which is due to symptoms of pain and bleeding being reported. Also, a study conducted discovered that initially prior to insertion of the IUD, the uterus is composed of bacteria, therefore contributing to a risk in genital tract infection. Notably, the use of antibiotics like azithromycin or doxycycline does not decrease the risk of genital tract infection during the time of insertion. Often discussed in regards to ethical issues with long-term contraceptives is reproductive freedom.
Cost and accessibility of intrauterine devices. The graph shows the prevalence of the use of the intrauterine devices spread out across the world in regions such as Asia, Europe, Africa, Latin America and the Caribbean, Northern America, and Oceania. Given that prevalence and accessibility are directly proportional, cost plays a huge role in determining the prevalence of the use of intrauterine devices. For example, the highest rates of intrauterine devices in the world are in Asia, particularly in China, where the cost and the placement of the intrauterine device is free of charge as seen in the table. Europe also has the second highest rates of the prevalence of intrauterine device use, given that for most European countries, the rates are cost-friendly, with the UK leading by example by offering intrauterine device services free of charge. Intrauterine device services can be accessed in numerous locations such as healthcare providers' offices, sexual health clinics, contraception or youth clinics, abortion clinics, and hospital-based community clinics. However, access to intrauterine devices becomes a challenge, especially in countries with geographically isolated rural populations where there are limitations to transport and access to healthcare.
Whilst the use of IUDs as a birth control method is continuously increasing over the years, various issues are associated with this medical device despite its efficiency. Community issues raised in regards to the Dalcon Shield IUD produced in the 1970s was found to cause high rates of infection which became septic pregnancies later. It also failed to prevent pregnancy. and in total 4 deaths occurred as a result of this device. This raised various lawsuits and negative media attention in regards to IUDs. Over the years, IUD device models have been improved significantly. However, one of the most common issues is contracting an infection, which can lead to more serious complications like pelvic inflammatory disease. Expulsion is another associated limitation. This is when the IUD moves to the top of the uterus and occurs in about 2 to 3% of women. This can lead to women getting pregnant and or using another form of contraceptive like a condom because the device has been expelled from the uterus. Perforation usually occurs when the IUD pushes into or through the uterine muscle. It happens approximately 1 to 2 times out of every 1,000 IUD insertions. This usually happens while inserting the device. Women most at risk at perforation are those who have recently given birth or are breastfeeding. Women that experience abnormal health conditions such as blood clots, diabetes, ovarian cancer, and STIs may be at a higher risk of developing these IUD-related complications. Scientists may believe that future developments will help to further resolve these societal issues.